Hello everyone, this is Dr. Clark from the Center for Weight Loss Success, and I want to do a quick little video on hemoglobin A1C. We talked last time about carbohydrate sensitivity. We've talked about kind of what does it mean when you say your blood sugar is a certain number, such as 100. It means a tiny amount of blood sugar actually in the bloodstream. But so what is hemoglobin A1C? We check this in diabetics all the time, and if you're a diabetic, you probably have a good idea, at least, of what we're talking about. But what actually is it? Okay, hemoglobin A1C. It's a way for us as clinicians that we can actually get a good idea of what has your blood sugar done on average over the past 3 months. Now, hemoglobin A1C, let's break it down. Hemoglobin actually is part of a blood cell. And hemoglobin itself helps carry oxygen throughout our body. So we have to have hemoglobin. They're part of our blood cell. And this is just actually a protein. That's all it is. It's a protein. Hemoglobin A1C is a section of a protein on this hemoglobin molecule, and it can get a sugar molecule attached to it. And it's an abnormal sugar. So it doesn't normally happen except at a certain level of blood sugar. So it gives us an idea then what is your blood sugar done on average. So if I could measure your blood sugar second to second, day to day for a 3-month period of time, we could figure out what is your average blood sugar. The higher that average runs, then a higher percentage or higher amount of blood or sugar molecules are going to attach to a hemoglobin. And it's in this section that's referred to as a hemoglobin A1C. So we can draw your blood, look at the blood cells, and see what percentage of these molecules have an abnormal sugar stuck on them. So it's measured as a percentage. 5%, okay, so our hemoglobin A1C is, say it's 5%, it means your average blood sugar is about 100. Okay? Now for every 0.1 above or below 5%, you can adjust that 100 by between 3 and 4. So if your hemoglobin A1C, let's say, was 5.5, okay, then your 5.1's above 5%, so 5 times 3 is 15, 5 times 4 is 20, so somewhere between 15 and 20, we'll call it 18, okay, you add that to 100, so your average blood sugar would be somewhere around 118. Okay. Now, why should you care, or why is it important? Okay, well, the higher your blood sugar runs on average, then the more likely there's going to be abnormalities or problems that occur due to the blood sugar. And what I mean by that is, the higher your blood sugar tends to run, is that these sugar molecules that are in your bloodstream will stick to other things as well, not just the hemoglobin A1C. If it was just the hemoglobin A1C, it probably wouldn't be a problem. It would just be an idea, okay, here's what your blood sugar is. But the blood sugar molecules not only stick to the hemoglobin, but they'll stick to other tissues. And it's typically proteins along the tissue, and especially along blood vessels. And just like if you spill sugar on your countertop, it's going to get sticky. Well, same thing is going to happen here. It's a little oversimplification, but it's going to get sticky, and therefore it can get sticky and it gets thicker, and it tends to get more brittle, and it causes damage to the cells. And so this increases risk significantly for cardiac disease, kidney disease, eye problems, and neurologic problems, because these sugar molecules get stuck on other tissues and subsequently then start causing problems. And we refer to this sugar sticking to a protein as glycation. And glycation occurs all throughout your body. So the higher your blood sugar tends to run, then the higher these sugar molecules attach, or the more likely these sugar molecules are going to attach to tissues. And when the tissue, these proteins have an extra sugar molecule on there that shouldn't be there, they don't function optimally. And if they're not functioning optimally, now we've got problems. And so this is where these things all arise from. So hemoglobin A1C is just a way for us to measure that. But it doesn't mean there isn't problems coming other places. There are. And we often refer to these glycated products as advanced glycation end products, or AGEs. And this is thought to actually cause or increase cell damage, which tends to increase aging. Okay, so it does. There's a lot of things, and you'll notice we often refer to as diabetics seem to age faster. and it's real. And it's because these blood sugars get out of control. So it's really important to keep blood sugars under control. And not just at the diabetic range, where we often say diabetic range, hemoglobin A1C is 6.5. That labels you as diabetes. But reality is that anything going up above 5 is going to be problematic, or potentially more problematic. So you want your hemoglobin A1C as low as possible, in that 5 range or even lower. If you can get it in that 4 point something range, you're actually really good, because that means your blood sugar's in that 80 to 90 range, and that's a good thing. Okay? So you want to kind of prevent these things from happening. If you think about it, these glycation, when it occurs outside the body, it basically helps with browning. Okay, if we're cooking something, that's what we're actually, when we're browning something on the oven, we're glycating things, is that you get these sugar molecules that caramelize. And again, it causes some stiffening, but also more fragile. The same thing is happening in our body. Again, an oversimplification, but it is real. So it's very important to keep that hemoglobin A1C controlled. It's important to know your number, but it's also important to kind of keep those blood sugars well controlled, your average blood sugars well controlled, and subsequently then it can help you have a longer, healthier life. All right, if you have questions, comments, just post them below. If not, we'll talk again soon. I'll keep these things coming. Have a great day. Take care.